Hello, doctors, friends of homeopathy, and students of homeopathy. Today is the 1947th day of uninterrupted daily webinar of IFPH. And today's our guest is Dr. KULWANT SINGH, ex-dean, faculty of homeopathy, Vinoba Phave University, Hazaribagh, Jharkhand. Dr. KULWANT SINGH is the principal and professor at Singhbang Homeopathic Medical College and Hospital, Jamshedpur. He is a teacher since 43 years. He presented several seminars in and outside India, like the Arab Health Congress, Dubai 2014, resource person of seminar of Ministry of Ayush at Vigyan Bhavan, New Delhi, resource person seminar on homeopathy by Central Council of Homeopathy, Siri Forte Stadium, New Delhi. And he's the ex-chairman of Homeopathy Literature Committee, CCH, New Delhi. He's a PG grade of Rajasthan Vidyapeeth, Udaipur. And he's the ex-inspector of Central Council of Homeopathy, New Delhi. Today, the subject is psoriasis, the monster. It's the second part of the series. Let's welcome Dr. KULWANT SINGH for the session, and I welcome you all for the session. Let me make you the co-host. Just a minute.
Good evening, and thank you all members of IFPH and others attending this seminar. This is the second part of my first seminar on this topic, that was psoriasis, the monster. In the first part, we discussed the etiology, the causes, the symptomatology, the types, the complications of psoriasis in detail. Today, we will try to discuss the roadmap for the treatment part of this most difficult problem, that is psoriasis. This roadmap starts with the basic concept of miasm, which should be very clear in our mind. Otherwise, it will be very difficult to treat the case of psoriasis, because it is an autoimmune disorder but disturbs the complete miasm. And miasm diagnosis means the diagnosis of different layers in the problem, different layers in the disease. There are two kinds of things in the system. One is chronic symptomatology, chronic diseases, chronic part, and one is the superficial acute part, which we can say that the acute layer, the layer which is covering the chronic thing. So first of all, we will have to remove the upper layer, then we can go to the deep-seated problem of psoriasis. So we hope that we will try to understand this in our lecture. So miasmatic diagnosis is the cornerstone of homeopathic treatment for psoriasis. It lies in the understanding the underlying miasmatic influence. That is very, very important. And second part for this roadmap is there is a prescription which is constitutional prescription. The constitutional prescription means that it is tailoring remedies to match the individual's unique constitution. What is that? So selecting a deep reckoning remedy, constitutional remedy that corresponds to the patient's totality of symptom and the dominant miasmatic influence, psora, syphilis, psychosis, or combined miasm, will come to that. And this remedy should aim to address the individual's overall constitution and underlying disease predisposition. Commonly used remedies are anti-miasmatic remedies, which we can use in our practice, but the basic concept for curing a case of psoriasis is a constitutional prescription is required besides to relieve the patient acute problem. So there are some, besides the autoimmune disorder, there are some problems which are acute, like severe pain, burning, scaling, layering, itching, redness. All these kinds with the basic concept will be there. So first of all, we'll have to relieve the acute symptoms, acute miasm of this chronic problem. And these layers are, you can see, the layer management is very important to cure a case of psoriasis. That is addressing suppressed and presenting health layers effectively. Normally what happens in practice life, you will see practically that psoriasis patients are coming to us after several months or years of treatment. This treatment may be internal medication, these treatments may be steroids, these treatment may be the outer applications, including steroids and other things. So all these things complicate a case of psoriasis, and you will have to be very careful in choosing the roadmap, the methodology by which you will try to cure a case of psoriasis. And this is the point where we fail in general. We are not very clear in our mind, we are not very clear in our concept that what layer should be removed first, what symptoms should be removed first, and then we'll go deeper and deeper. There is acute flare handling is very, which I have already been repeating. The acute handling of the managing sudden health flares with appropriate remedy. So this sudden acute flare handling is very important during exacerbations of the psoriasis, characterized by, I told you, burning, scaling, oozing. Acute intercurrent remedies may be necessary to provide relief. Some commonly used acute remedies may be there, which we will discuss in our treatment part. And the most important part, which we often neglect or the patients neglect, that is cure maintenance. Once your patient is better or relieved totally or remarkably, then it is very important for us to see that the patient's symptoms are maintained properly. There is no flare, there is no relapse, there is no recurrence of the problem, so that the patient becomes normal. So that is, the maintenance depends on the, like we encourage the patient to adopt a healthy lifestyle, including exposure to sunlight, avoidance of chemical suppressants. These factors can help to maintain the cure and prevent relapse and treatment of the part. So now our next aim is to diagnose a case properly as per the miasm. We all know there are psoric phases, there are psychotic phases, and there are syphilitic phases. So there is psoric psoriasis is a functional root of psoriasis. That is the functional root of psoriasis, characterized by dry, scaly, itching eruptions by heat. So these aggravation by heat, and the medicines, most common medicines are sulfur, sodium, arsenic, and there are so many others. If the patient is of psychotic nature, then there will be known as miasms of accumulation and thickening, miasm of proliferation and thickening, miasm of growth and thickening. So this miasm proliferates, there is growth, there is keratinization, deposit of keratin in a very speedy type, when there is growth, overgrowth of the skin, and there are layers and layers and layers. So this overgrowth is a psychotic miasm. So miasm of accumulation and thickening, very clearly said here, miasm of accumulation and thickening, it presents with thick, raised, warty lesions, aggravation by damp food. The medicines are thuja, medorodum, natrum, sulf, and nitric acid. And third is the syphilitic psoriasis, where miasm, it is miasm of destruction and ulceration. Miasm of psoriasis, miasm of accumulation and thickening, miasm of destruction and ulceration. So here syphilitic miasm, there is ulceration, involved deep destructive lesions with night aggravation, burning pains, and there is Merksol, syphilidum, calii. Next is the combined miasms. What will happen in combined miasm? You can see there is combination of psora and psychosis. There is combination of psora and syphilis. There is combination of psychosis and syphilis. The psora psychotic combination is, psora is functional disorder and psychotic is proliferative disorder. So psora plus psychosis, functional disorder plus proliferation. So this alternating dry and moist eruptions treatment begins with an antipsoric remedy to open the case followed by an antipsychotic remedy. You mark these words to open the case. You have to diagnose a medicine which will open the case totally, because this patient is often suppressed by different methods. So you will have to open this case so that the clear picture of the case comes in your mind, and then you will be able to prescribe a proper constitutional medicine. So that is combination of sora and psychosis. Common medicine, the sulfur to thuja, lycopodium to madorna. Second phase is sora and syphilitic, that is functional and destruction. So there is deep cracks and destructive tendency. Treatment involves a sequential mathematic approach. Begin with an antisoric remedy to stabilize the condition, then follow with an antisyphilitic remedy to heal the destructive phase. Method is easy. Has been explained very nicely, but you'll have to concentrate on the symptoms similarity. Choose a good medicine, choose a proper medicine for your selection part, and that will help you to take care of the problems. And third part is psychosis and syphilitis. Syphilitis is destructive, psychosis is proliferative. So there is thickening of plaques, resistant to treatment, and very difficult. Psychotic and syphilitic combination cases are very, very difficult to treat and cure. But we will try, and we have tried, and we have been successful in some cases. So their treatment requires a deep anti-miasmatic sequence to control proliferation and destruction. Puja followed by Merksol, followed by Syphilism, etc., depending on the condition. There are some basic medicines which can be used for treatment of this problem. We'll come to that. Will not go in much detail, but these are a few medicines like sulfur, which is having itching and burning, which is aggravation by scratching. There is scaly, dry, unhealthy. We all know these symptoms. These are just an indication for how we will try to approach a case of psoriasis with the help of some important medicines, which are often indicated in these cases. Arsenic album, there is dry, rough, scaly rain, and arsenic is always better by heat. Coldness, burning sensation, better by heat. Burning better by heat is a great keynote for arsenic album case. Burning better by cold, there are other medicines. Restlessness, anxiousness, and fearfulness. These three are the great mental symptoms of arsenic album. Graphitis is well known by the appearance of the skin of the case. There's thickened skin, hard leathery skin, and there is honey-like fluid which is oozing. So this is honey-like fluid oozing. Complete dryness of the skin is often contraindicates graphite. If there is no oozing, if there is no discharge from the skin, from the lesions, graphitis is rarely indicated. Petroleum is another very important medicine and one of the best medicines to cure psoriasis, because it has a particular skin symptom, that is deep painful cracks in the skin, hands, fingertips, and joints. These are the great indications for petroleum, and these indications are found in psoriatic cases very often. So due to this symptomatology, petroleum is a medicine which is very helpful and aggravated by cold and winter. This is very important. Worse in winter and on the hand. CPI is another constitutional medicine, but CPI constitution, CPI mind symptoms should be present. Then only prescribe CPI. Otherwise, CPI won't help you in case of severe psoriasis. So there is a dry, chapped, and cracked skin, whatever will be there, great sense of weariness, indifference. This is a great keynote for CPI, and mental symptoms must agree. There are some other medicines, that is Rustox, arsenic iode, Caliar, Spagopyrum, and hydrocodone. These are a few important medicines which can be used in cases of psoriasis. In case of Rustox, there is red skin, swollen, intense itching and burning, aggravation by night. and damp weather. Practically, Rustux is not a very important medicine in psoriasis. Psoriasis needs more deep acting remedies. This is one of the king of psoriasis, arsenic, a very, very nice medicine which helps to cure, which gives you name and fame when you cure a case of psoriasis. And rapidly progressing exfoliation. Remember this word, exfoliation. There is exfoliation of skin, different layer coming out, severe burning, itching, and scaling. And eruptions with thin, watery, offensive discharge is a very important as arsenic ion. There is one other medicine which I will tell you, which is very important for curing a case of psoriasis and this which offensive discharge. Kaliars is very chronic, very important medicine. When all these acute medicines work, then to follow their action, Kaliars is one of the best medicines. Chronic obstinate psoriasis, that is what I was telling. The chronic cases which are not being cured in spite of giving proper medication, then Kaliars is a great help. And I have found in my practice also the Kaliars, arsenicars, these are very beautiful medicines to help you in a case of psoriasis. Next is Fagopyrum. Fagopyrum is an acute medicine. It is not a chronic medicine, but it helps to relieve severe itching. If there is very severe itching, burning, and stinging in skin, then you can give Fagopyrum as acute remedy to relieve the patient. Fagopyrum is very good. Mind my words, it is very, very good, but it is not very chronic medicine. So it will help you improve the acute condition of the patient. And another hydrocotyle, which I use in mother tincture form, but it is very important because of the thickness of the skin, which the symptom which is having. Epidermal layer, exfoliation of scales, psoriasis gyrata, also called gyrate psoriasis, variant of psoriasis, ring-shaped lesions with an intolerable itching, dry eruptions, and there is one more symptom which is very important for hydrocotyle, that is great thickness of the skin. There is deposition of keratin on the skin on a regular basis for a very long time, and then there are permanent thickness of the skin. This was the medicine which I was talking about. Very, very one of the best medicines in my practice life, that is Pix liquida. What is Pix liquida? Pix liquida is a medicine which is made by coal tar of pine tree. There are pine trees in the olden times, in the times of you say Galen and other senior ancient times, people were using this coal tar. They used to have charcoal from the pine trees, and they used to apply this tar to the parts where psoriasis was there, and this was greatly helped. Nowadays also, at present also, you can have ointments of this Pix liquida which are available in market. These are available in market as pine charcoal. So this, what is the quality of Pix liquida? Basically, it is very nice medicine for psoriasis because it is anti-keratolytic, anti-inflammatory, anti-proliferative. So all these 3 points are present in case of Pix liquida. Anti-keratolytic stops the formation of keratin, thickening of the skin. Anti-proliferation stops the growth, extra growth. Anti-inflammatory molecules in tar reduces cytokine-driven inflammation. So this Pix liquida is having that property. And one or more diseases has antipruritic action. So this, how does this work? Pix liquida desensitize the cutaneous sensory nerve. There are sensory nerves. By applying or by giving Pix liquida, they desensitize and the itching is greatly reduced. I have been greatly benefited by this rare medicine, but very helpful medicine for treating a case of psoriasis. Remember this name always. I have especially mentioned this name. And the stoppage of growth of this is helped by the anti-keratinocyte function by neuroimmunological modulation. So there is affinity of keratin. This affinity for keratin is that it is effective for thick scaly plaques, psoriatic lesions, tar-like itching, addresses itching that worsens at night, offensive exudation. I told you last also that offensiveness is a great keynote for Pix liquida and arsenicum iodine. So next, some medicines I would like to specify for special type of psoriasis. We have discussed there is plaque psoriasis. You can see these are the plaque psoriasis, and the best medicines are the thinness to thickness. The medicines are fagopyrum, carbonium sulf, hydrocotyle, Pix liquida again, and kisarobinum. But most often and most fagopyrum will help you in thin layer where only itching, red plaques and severe itching is there. Carbonium sulf is for the chronic problems. Hydrocotyle is a great remedy when there are circular patches with intense itching. Pix liquida, scaly plaques, intraoral itching, and offensive discharge. So these are the best medicines. These 5 are the most important medicines to cure a case of plaque psoriasis. We know plaque psoriasis has, it is 80% of the psoriatic cases are of plaque psoriasis. You can understand how important this plaque psoriasis, treatment of plaque psoriasis is there. Next is nail psoriasis. The second most important part, most common part of psoriasis is homeopathic remedies for nail disorder. So that nitric acid, most important, antimcrude, thuja sometimes helpful, graphitis is helpful when there are cracked nails and deformity of the nails. Antimcrude is having brittle nails, distorted nails. Nitric acid is less important. Thuja is given as intercurrent remedy, and silesia is very good when there is roughness of nail and brittle nail. Brittle nails are always present in all medicines. So these are a few medicines for nail psoriasis specifically indicated for nail psoriasis. Plus, mind my words, I am repeatedly telling that these are the medicines which are specified for this particular condition. But along with these medicines, the constitutional medicine, the medicines based on totality and miasm will only cure a case. These medicines will help. Sometimes what happens that if you see that the case is of thuja accidental, so if you give thuja, that cures the case completely, because this is a great anti-miasmatic medicine. So it helps in the acuteness also, and it helps to clear your case also. Next type was inverse psoriasis. We have discussed in the last lecture that inverse psoriasis is a psoriasis which is found on the joints, fold of joints. The location occurs in the skin folds, appearance smooth, red, inflamed patches aggravated by sweating and friction. So in these cases, sometimes one important medicine which will relieve the symptom is sulfur. And to cure the symptoms are graphitis, petroleum, thuja. These 3 are the most important medicines which will help you cure these cases. Next important type is scalp psoriasis, which we have found in so many of patients. The patient comes, looks like a seborrheic dermatitis, dandruff, but these are not dandruff. These are pure cases of scalp psoriasis. And in the scalp of arsenic album is very good. Kali ars is one of the best medicines. Mesothelium is given when there is thick scabs under the eruption. There are thick scabs here, they are there. Here somewhere, sometimes there are there. So there is a thick scab below the skin. Sometimes there is formation of pus or oozing in that case. In that case, the mesothelium is medicine. 2 other very good 3 medicines are there for scalp psoriasis specifically. That is graphitis, when there is oozing from these discharges. One important specific medicine is viola tricolor. Very nice medicine to cure these kind of cases. And one is oleander. So oleander also is a medicine which will be helpful in case of treating the psoriasis. But oleander is also one of the best medicine for treating seborrheic dermatitis. Next, the most dangerous part is erythrodermic psoriasis. This is very difficult to treat. Please mind my words. I have told in last lecture also that erythrodermic psoriasis is very dangerous, and please don't try to handle it. If the case is very serious, my opinion, my advice is don't take up the case. This may be fatal sometimes, but the most important medicines are polyporous pinicola, best for ring-like patches with periodic aggravation. There is bromium, there is Calias, clematis, and calipro. But please be very careful when you try to treat a case of erythrodermic psoriasis. These are a few medicines which are important. That is manganum aceticum, sometimes used fixed liquid, I have discussed, hydrocodone I have discussed. Radium brome is a case when the psoriasis becomes very rigid, very obstinate, very stubborn. So stubborn psoriasis with intense itching, sometimes rhodium bromide may help. And arsenic iodide I have discussed, Physaroginum I have discussed. So these are a few important medicines by which we can proceed to treat the cases to give acute relief to the case, plus additional help with the constitutional medicines based on totality of symptoms and myelin. Psoriasis, sometimes we see, and I've been teaching since last 48 years. So we come with across so many students, doctors who are sometimes depressed that psoriasis cases are not cured. We have tried so many times. I'll try to illustrate a few cases which have been completely cured by homeopathic treatment. This is the case number 1. You will be surprised and you will be shocked to see the intensity of this case. You can see this case, the complete hands condition of the hand. There is almost degenerative process starting. There are scaling, there are oozing, there are severe cracks. It was offensive. And I was also afraid. I was very not keen to take up this case. I almost refused to take this case because I thought that it will be very difficult to help these cases with this intensity. I asked the patient, you go take some allopathic medication, and when if you are better, please come to me. But they insisted that they have already tried some medicines and there was no relief. So practically, just as a palliative medicine, I started the treatment. Very sensitive. These parts were very sensitive. Very difficult to touch the patient, touch the parts. The patient was crying with pain. Depending on that oversensitiveness, I prescribed Hipersulf to prevent the pus formation and sepsis, gunpowder 3x. 3 times daily, pyrogen 204 doses 2 times, and echinacea mother tincture for 25. So this may be pure, not pure homeopathy, but in the first stage, I prescribed the following medicines. Hipersulf 30 for oversensitiveness, gunpowder 3x, pyrogen 200 to prevent the further pus formation and sepsis formation. And hopefully, by the grace of God, you see the changes. After 8 weeks, this was the case. Now, after 8 weeks, this is the case. You can see how this foot is improving, the legs are improving, hands are improving, the swelling is there, but that sepsis condition is gone. But there was offensive smell, there was severe scaling. So depending on this, I prescribed my favorite medicine, arsenic I have 33 times ago. For 8 weeks, this medicine continued, and after 8 weeks, this was the condition of the patient when this was almost better. Patient was relieved, was very happy, young girl, and then can see again after 8 weeks of the case, this is almost 50% flow. The hands have become very nice. His hands have become very nice, much better. The soles are almost better, and the legs have also improved. So this was a great improvement with the help of homeopathic treatment. And I didn't change my medicine. I repeated arsenic iodide 30. After 4 weeks, you can see the magic of medicines. I have not given anything extra. Only arsenic iodide is continuing, and the patient is feeling much, much better. But after 30, I have given 30 for a very long time. This time when the patient came, when her hands were better, the legs and foot improved a lot, I prescribed arsenic iodide 200 only 2 doses, plus echinacea as an additional help. Echinacea is not a proper homeopathy to that, but echinacea, I have tried in my practice life that echinacea mother tincture given in skin cases helps. Roughly speaking, it purifies the blood. Indirectly speaking, it improves your autoimmune problem. So echinacea mother tincture 10 drops 2 times plus arsenic iodide 200 2 doses, and I asked the patient to come after 8. Now see the magic. It is unbelievable, unbelievable that after 8 weeks, arsenic iodide 200, how the patient almost cleared the soles, the legs are almost clear, the sole is, this is much, much better, this has improved. The hands have improved. There are, she was bandaging 2 fingers because there were some eruptions and pain there. But otherwise, the hand, the topmost of the hand, you can see all these things have improved. This is, seeing is believing. Forget about everything else. Believe what you are watching. Again, I asked the patient to come after 4 weeks. Now see. Isn't this a magic? The great, great blessing of Dr. Henneman. Arsenic iodide 200, no repetition. Only continuation of echinacea method. I was continuing echinacea because it was working. Why change the medicine? The medicine which is working, which is helping you, why change the medicine? So I didn't give arsenic iodide. Arsenic iodide was working properly. So I just gave echinacea by the tincture 10 drops twice. And this is the case. Almost everything cleared from everywhere. Now you see what you saw in the beginning. And now you see what happens. And after, I asked the patient to come after 8 weeks. You see. Hands almost cleared. 95% hands are almost cleared. The patient is almost clearing the problems. See. The hands have become completely normal after 8 weeks. Arsenic iodide 202 doses. That was a magic. It suited to the patient by taste. And hands become normal. You can see, these hands have become normal. And there is no relapse in the last, say, 1 year. I've been treating, and she is not on any medicines now. Arsenic iodide 202 doses. That's all. So this is one of the examples how proper medication and proper dosage. Sometimes what we do, arsenic iodide is working, we keep on repeating. We are just prone for that. We are tempted to that. Oh, arsenic is working very good, arsenic iodide, let us repeat. but don't repeat the medicine until unless the medicine is working. Repeat the medicine or increase the potency when you feel that the medicine action has stopped. But in this case, the medicine action was continuing, the patient was better, she was improving. Now see the condition from this to this. This was the first case which in my practice was cured by proper selection of the medication. Now we will come to the case number 2. This is a case of a lady which was basically, she was a, I don't want to say, but she was a cook. She was a cook by profession and she lost her job due to this problem. And she was the only earning member. She was the only earning member in her family. She was literally crying and crying and crying when she came to my team. You can see the picture. All the hands, and it was very bad in the legs also. There were eruptions. And as I told you in my last part that KULWANT is the medicine when the eruptions are very stubborn, very chronic, not scaling very highly. If the scales are very high, then arsenic iodide is medicine, petroleum is medicine. But if the psoriasis is very deep-seated, the scales are not very high, but the lesions are very much there, and there is keratinization. This is keratinization, deposition of keratin, thickening of the skin. Thickening of the skin is there. In this case, I started my treatment. This was aggravation by warmth of bed, scratching, better by cool open air, thick, hard, dry crust with offensive discharge, intense burning and itching. I started my treatment with KULWANT 30 and asked the patient to come after 4 weeks. So this, you can see after 4 weeks, little improvement. The patient felt little better. There were improvement. The top part was improving. This part was improving. These parts were improving. But there were lesions here. This part was improving. The patient was little satisfied. Leg were or improving. There were, you can see the patches here, the marks of the patches here, the marks of the psoriatic patches here, here, here. So all were started improving after 4 weeks only. Then I didn't change my medicine. I gave KULWANT 30 and asked the patient to come after 10 weeks. Then see what happened after 10 weeks. This is seeing is believing. The patient is in front of you. You can see, you must believe on the action of homeopathic medicine. So you can see how these legs have improved completely. There are lesions, there are scaling, but much, much better than the old one, the old condition. Then I asked the patient to come after 12 weeks. She came after 14 weeks and see. Then again, I saw that the condition is better, but not improving 100%. It is better, it has improved a lot, but not completely cured. Then I prescribed KULWANT 202 dose. The patient was on KULWANT 30, but then I prescribed KULWANT 200, 2 doses only, and left with Saclac 5 times. So she was taking Rubrum very happily, and she was much happy. She started working with the help of having gloves. Her employer, they allow her to work after seeing the conditions of the hands, but still there was a problem. The patient, I asked the patient, I gave 200, I asked the patient to come after 20 weeks. After 4 or 5 months, I go, if you feel better, come to me after 4 or 5 months. In the meantime, she was coming, and she was taking Saclac from my assistant. But no change in medicine. After 20 weeks, see, The top part is almost clearing. The top part of the hand is clearing. The legs have almost cleared, and there are some, because there was severe keratinization of these parts, severe thickening of skin of these parts. It is taking a lot of time. There was no change in medicines. I gave placebo, but later on, I thought that I should have given her hydrocodone. It was my feeling that I should have given hydrocodone mother tincture with phytum, but anyway, I didn't give, and I called the patient after 6 months. Just continue, come to my clinic, take placebo, but no change in medicines because the medicine was working nicely. Calias 200 was working nicely. And see, now, after 24 weeks, the magic started. Completely, almost the legs are cleared. And in addition to this, see this. After 30 weeks, 6 weeks again. So the hands are almost cleared. Only the patches are remaining. The psoriatic lesions have been cleared completely. Only the thickening of hand is only here. The top of the palm, there is a slight thickening. You can see this thickening, and what thickening was she having earlier? You can see this, and you can compare this thickening. This was the thickening, and now the thickening has reduced. The case has improved a lot, and as there was thickening, some restriction, so I gave Calias 200 repeated again, and 1 dose of Cefilin. 1 dose Cefilin 1m, and after 3 days of taking Cefilin 1m, she was asked to take Calias 200 2 doses. That's all. Patient was very happy, of course. She was able to work. She was not having pain. She was avoid of any other problem. And now see what happened. Nobody, she herself did not believe that how she can be better like this. How she can be better like this. No marks, no scaling, only those 1 or 2 patches or small patches are there. The entire hand is clean. The entire hand is clean. No medication. Now see. No trace of the disease. There is no trace of the disease. The complete patches have gone. The patient has improved very nicely. This is the effect of proper homeopathic medication if you select them properly. Only selection is important, and posology is very important. When to repeat, when not to repeat, when to change the medication, and have faith on yourself also. If you have faith on yourself, then you have faith on homeopathy. And these kind of stubborn cases, most difficult of cases, are being cured by homeopathy. Next case is also very important, and an example. Last 2 cases you saw that I almost prescribed pathological on the skin symptoms only. But this was a case where I prescribed constitutionally because there are so many complications in this case. So lady, young girl of 25 years, she was suffering from psoriasis from 5 years. And the psoriatic symptoms were dry, thick, rough scales, intense itching with burning, chronic stubborn plaques. The patient was obese, very fearful, and above all, she was also having PCOD. So there was PCOD, there was irregular menses, there was profuse sweating. So depending on this constitutional symptom, I prescribed, patient was definitely obese, she was having good health. So I prescribed Calcarea Carb 1m, 6 doses for 3 days. And after finishing Calcarea Carb, I asked her to take Pix liquida 33 times in a day. See the case. This was the basis of my prescription. Calcarea carbonum on the constitutional basis, Pix liquida on the skin basis. You can see the skin. This was the case where the young girl was suffering the legs, the hands. This was in both hands. This is the left hand, this is the right hand. Completely in trouble, serious trouble due to psoriasis. She is suffering since last 5 years. And along with that, she was having PCOD. So I prescribed this medicine, and after 8 weeks, she was called again. After 6 weeks, you can see the legs have improved. You can just compare. This is the condition, this was the condition. Now you can see the legs. This has improved a lot. The legs have improved a lot. The hand, the eruptions, you can see this right hand, the complete patches and eruptions were there. Now you can see these hands have become normal, almost normal. There is hypopigmentation of the skin. There is hypopigmentation, whitish pigmentation. When the patient, the eruptions are going, they are leaving a white mark, whitish pigmentation, hypopigmentation in that case. The patient was no medicine change, Pix liquida 33 times in a day. She was caught after 8 weeks. No fee. What happened? This hand is completely clear, left hand is completely clear. Some patches were there earlier. This is earlier picture. After this, this is the picture. This is the right, this is the earlier picture. After this, now this was the picture. These were the latest picture. These are the earlier picture. So now the patient is becoming normal and normal and normal. Again, after 4 months, the patient was called, and you can see now the dramatic change. But I was really worried that what will happen to these patches, because this will, as she's a girl, these patches, hypopigmentation patches, will create again a problem for her. So I was really worried for this, but I was not confused that I have prescribed the correct medicine. And the first prescription was Calcarea carb. And now I asked the patient to go for an ultrasound. And the ultrasound showed that the PCOD part was cured. Ultrasound shows that there is no ovarian cyst. The menses have become regular, even though I just repeated Calcarea carbonum 6 doses again. The first prescription, which gave it for a few months back, and due to that Calcarea carb dose, the PCOD part of the patient became normal. So that was the constitutional medicine for her. It cured her completely, and her patches, you can see now, these hypopigmentation patches are there, but some rashes, very small part of rashes are present there. Now see the case. After 36 weeks, completely normal. This patient is now much, much better. The treatment is still continuing because these hypopigmentation patches have come to almost normal. You can see, compare. See, this was horrifying. These hypopigmentation patches, they are horrifying. But now you can see, these are almost gone. They are there, and treatment part is continuing. They are only Pix liquid. So this is the effect of homeopathic medication on serious problems like psoriasis. One more case, I have time, so I will show you one more case. You can see. It's very shocking, very fearful. This case, when you look, definitely you are shocked. Like severe cracks, burning, bleeding, nothing. A very offensive smell, scaling part is there, the severe scaling, and I prescribed simple arsenic iodide 30. And as I showed you first case, just to help the patient, I prescribed echinacea mother tincture. So I prescribed echinacea mother tincture, arsenic iodide 30. What was the basis of prescription? Painful cracks, scaling, exfoliation, leaving a red raw exuding surface. Leaving a red raw surface, that is a great keynote for arsenic iodide. I prescribed her arsenic iodide. I gave calendula Q for external use, just to clean the part, and echinacea 10 drops 2 times. I'm not sure how far echinacea was helping her, but definitely arsenic iodide was the medicine for her. Please keep it in mind, if your selection of medicine is correct, the medicine will work and it will remove the acute conditions plus the miasm also. Arsenic iodide is a medicine which works in all miasms. It is antipsychotic, antisyphilitic, plus antisocial. So if your medicine is correct, it will cover all miasms. Don't forget, don't fear about big things. We have to go totality, we have to go constitutional medicine, we have to repertorize every case and then decide, and complete mental condition should be matching. Take help of them. We cannot ignore them. But if your selection of medicine is correct, it will ultimately open and remove the symptom. Mind it, it will open the case. Dr. Luke Shepard from US, he met me once, we met him. So we were having a chat for a very long time, 2 hours. So he's an authority in homeopathy. So he told us, we were a few people, just believe in this point, that try to open a case just like we peel the onion. He said that word. Just like we peel the onion, we remove one layer by one layer by one layer. So just depend on that. When you take a case, just peel, just open the case. When we open the case will help you. Case will guide you in the selection of medicine. And second part, he told that don't change your medicine unless or until you believe that it is working. So the patient was called after 3-4 weeks. Just remember this condition. See the condition of the patient. Lot of improvement in only 3 weeks. Arsenic iodide 30, no other medicine, no external medicines, no echinacea. I stopped all medicines, just continued with arsenic iodide for 30. See, after 6 weeks, you can see there is a lot of improvement, no cracks, no bleeding on the skin. And come again after 8 weeks, you can see now this patient has improved, this patient has improved. This is the earlier picture, this is the latest picture. The skin has completely cleared off. After this, this is the picture. The skin has completely cleared off. And you can see now. The complete patches have gone now. The patient is much better. The treatment is continuing. And in the last prescription, I forgot to tell you that I gave Sorinum 1 1 dose and petroleum 30 to continue. Because to remove the layers of the skin. And now you can see the case, this patient has completely normal. This patient has been cured completely. There are no rashes. Hypopigmentation is there. That also is improving. You can see this. The patient has completely improved. So this is my humble request, that please have faith on homeopathy, have faith on yourself, and don't change your medication just on whims. Have patience. You will be rewarded. Thank you very much.
Thank you, Doctor, for your excellent session. Very informative. And sure, this psoriasis is a menace, and
all doctors, all homeopaths, everywhere is stumbling on this block because what to do, how to prescribe for this, whether to deal with by constitutional medicine or things. Always it's a problem.
Yes, sir.
And thanks, doctor.
Thank you.
So it's now time to interact with the speaker. Very little time left with us.
Yes, please, if you have any questions.
Sir, actually, most of the prescriptions were pathological prescription. That means all the cases were so advanced, and you have to add some medicines here and there in between. And
Yes,
and this is what an experienced doctor can do. Usually, most people simply give a constitutional medicine and wait for the cure, but it sometimes it may not happen as quickly as what you have mentioned in this case. So don't forget about those small remedies which can give big results. That's what I have observed in this session. Am I right, sir?
Thank you, sir.
Sir, what's your what is the basic need of arsenic iodide and how it works, sir?
Arsenic, I would say, it is having arsenic, it is having iodium. Iodium is a very deep acting remedy. Arsenic itself is a deep acting remedy. Arsenic is covering all miasms. And a combination of arsenic and iode is having a great keynote, great property that is a great pure visual of psoriasis. Scaling, patches, fever itching, burning, pain, bleeding, all these keynote picture of psoriasis, arsenic iodide is covering all symptoms. And there is offensiveness of the discharges. So depending on these conditions, I have given arsenic iodide to several cases with great results. But one thing I keep in mind that I don't repeat very often, I don't increase the potency very often.
Sir, arsenic iodide is also very good for. Sir, arsenic iodide is also very good for upper respiratory tract infection.
Very good, very good. It is one of the best medicines for upper respiratory tract infections and my most favorite medicines for sinusitis. There is allergic rhinitis with sinusitis, severe nasal discharges, but these discharges must be acrid. So acrid nasal discharges with coughing and with sinusitis. Beautiful medicine.
Sir, you are using 30th potency of arsenic iodide.
I start with arsenic iodide 30. Normally I start with 30 and then go higher if necessary.
Okay,
and
sir.
in the meantime, please don't forget to give anti-miasmatic medicines in between.
Okay.
In case of allergic rhinitis, I most often use tuberculinum.
Okay.
Thank you, doctor. Thank you for this session. It's very informative, and it's time to conclude the session because time is now reaching to hand over the session to the Malayalam.
Wishing you all a very, very happy New Year, sir.
Thank you. Wish you the same. Happy New Year to you, sir.
Thank you.
And it's time to conclude. On behalf of IFPH, I thank you, doctor, for the full session, and I thank you all for being presented here for this session, and also Dr. Shaila for the Malayalam. Thank you.